Hey, welcome to This Week in Pharmacy. I am your host, Todd Urey from the Pharmacy Podcast Network. It is August 15th, 2025, and I am getting ready for another conference. We're going to be going to the NACDS Total Store Expo. Excited about that event. We'll be talking about that a little bit later in TWIRx. Today, pills to purse. Pills to purpose. Can you say pills to purpose 5 times real fast? That is a book written by Ritesh Shah. Can't wait to share this with you. We have a special discussion with Bonnie Bond from the Sykes Company, and she's coming to us on TWIRx from a recording from ThoughtSpot 2025 in Las Vegas. And that's today's episode is going to be sponsored by Sykes. And then we're going to be talking with Shrilik Dvorsky, and he's with TaylorMed. And there's just a lot going on, and we have news to go through. So just stand by and be ready. It's time to TWIRx. Hey, hope it's been a good week. Welcome to This Week in Pharmacy. I'm your host, like I said, Todd Urey, founder of the Pharmacy Podcast Network. Did you hear that there is a health podcast gathering of everyone that's interested in podcasting and the evolution of podcasting? And it's going to be called the Health Podcast Summit. Look that up. We're going to be talking more about it. We're going to have the founder of that and the organization that supports that talk with us and his mission. So you'll be stay tuned for more TWIRx on Health Podcast Summit. It's going to be a global event. It's going to be available October 1st and 2nd. But before we go any further, we're always wanting to kick off TWIRx with TWIRx News. And I want to start off with something disturbing, how a health center turns away patients as Medicaid approvals stall pharmacy services. This is out of 13 Wham ABC News.
Again, with a local pharmacy forced to turn away patients in need of prescriptions due to the Medicaid application process. Good evening, I'm Lowell Rose. The health center opened its pharmacy after others closed. 13 Wham's Natalie Calzatoni is back from the health center's Holland Street location with the latest. Natalie?
Yeah, Lowell, the president of Jordan Health says the center has spent the past several months submitting paperwork to New York State to get the necessary approvals, only to face rejection and delay. Last year, the Anthony L. Jordan Health Center opened a pharmacy in Rochester's Northeast neighborhood after a series of pharmacies closed throughout the area. Dr. Linda Clark says this year, the center has had to turn away the majority of patients due to the Medicaid application process.
Currently, more than 70% of our patients are enrolled in Medicaid program. That's more than 7 out of 10 people that walk in our doors looking for high quality care. Despite our efforts to undergo the application process to accept Medicaid customers, we are still not able to service everyone because we have yet to receive that approval from New York State to service our Medicaid clients.
Dr. Clark is asking for the support of state legislators so Jordan Health can provide care to all patients. Assemblymember DeMonde Meek says this issue is a priority for his office.
What we can do is work together collectively as a delegation and across the aisle to make sure that we're putting pressure on the powers that be, New York State Department of Health, you name it, to assure that, and even our governor, we'll reach out to the governor as well to say, hey, this is a problem we're having here in our community and we need to correct it yesterday.
In November, the city announced the Rochester Pharmacy Access Coalition and 4 large health systems, including Jordan, started providing those services to the public. Mayor Malik Evans emphasized the importance of access.
Think about it. If it's an HIV medication, or if it's something like insulin, or something to stop seizures, it's critical. And Jordan is really one of the last places, if not the only places, that operates in our neighborhoods.
And I've reached out to the State Department of Health for comment on this report and have not heard back.
So this is not a surprise to anyone listening that's in the pharmacy profession or the healthcare profession for that matter. Our healthcare system is really it's bent, it's broken in many ways, and we have to gather together and do more for our communities. And wanted to bring to light that news story, and a shout out to the center and to the pharmacists that are involved there. We're going to continue to promote this story to get it out to more people and try to get some of our legislators to understand that their policy is impacting people's lives and access to pharmacy care and better living. All right. I want to continue with news. This is a really interesting story. And I just want your opinion on this. I want you to know, I mean, the community pharmacies that are out there, you're always met with people that are bringing you questions about substances, about over the counter. I think our public thinks that if it's over the counter, it's safe and there's no harm that it could do. And we all know that's further from the truth. And people that toxicity levels rise in their kidneys and their livers because of taking too much vitamin D or V or vitamin C or whatever. But this article just came from Pharmacy Times, and the title is Pharmacists Knowledge Gap on Kratom, Building Competence for Patient Counseling. And this is an excellent article talking about Kratom's popularity in the U.S. It's rising. Pharmacists often lack knowledge to discuss its effects and interactions. And it goes into a great rundown of Kratom in and of itself, a little bit of the background, and then what pharmacists should be aware of in that substance. But then they also give you some examples. Great article out from Pharmacy Times. Next up in the news is navigating biosimilars in 505(b)(2) drugs in oncology, operational, clinical, and policy strategies for pharmacists. This is brought to us by Pharmacy Times once again, and this was published on August 15th, and it's a pharmacy practice in focus, and it goes through the biosimilar update. 505(b)(2) drug offers cost-effective alternatives but pose operational, clinical, and regulatory challenges on oncology care. I very much want your input on this. I want you to know about this. I want you to be aware of what's happening in the biosimilar space. Pharmacists are pivoting and integrating these therapies by collaborating with payers and providers to align formularies and improve patient access. This is the kind of conversations that I want to be having when we are covering the National Association of Specialty Pharmacies, the NASP. Their annual meeting will be September 14th through 17th in Denver, Colorado. If you are a specialty pharmacist and you're going to this event, especially if you're involved or understand biosimilars or have leveraged biosimilars within treatments, please let's connect. We would love to have your insights and the coverage of the NASP's 2025 gathering in Denver. Excited to be coming. Speaking of gatherings, like I started out when I said NAS and I wanted to say NAC, I was trying to say NACDS, the National Association of Chain Drug Stores. The Total Store Expo is happening August 23rd through 25th in sunny San Diego. I am looking forward to this trip. If you are going to San Diego, if you are in San Diego, maybe you're not going to this, and you want to connect, we would love to sit down with you and talk about the business of pharmacy. We're going to be at the booth with our sponsor covering our press event at the press booth, which is going to be 3523. That's booth 3523 at the NACDS Total Store Expo. A shout out to KeySource. Thank you so much, Andy Crawford and your team, for sponsoring us at this event, being able to cover it. We've been covering the NACDS for years, and it is a wonderful gathering of people in the business of chain drug stores and chain pharmacy, and the impact of that across the nation. I mean, that is so critical right now, that you're operating better and that you're doing better and that you're staying profitable and you're thriving, because we just don't have enough pharmacists. With the collapse of retail pharmacy, especially within the last 12 months. And it's going to continue to implode a little bit before it starts to change, but we're seeing some thriving, which is just wonderful. And we're seeing some independent community pharmacies leverage digital health. A shout out to IPC, Independent Pharmacy Cooperative, and their iCare Plus system, which is helping pharmacists to make money outside of just the dispensing fee. And I'm excited. I'm excited what's happening in pharmacy. It's challenging, but it's also extremely exciting. Hey, our special interview is up next, and that is with Ritesh Shah and his team and his commitment and his transformation from pills to purpose. Hey, and on This Week in Pharmacy, what a special opportunity to tell a story of a story and a purpose of a book, and the purpose behind this man, this pharmacist. You know, pharmacy is and you hear this on TWIRx a lot, but pharmacy's changing. We're going through a volatile time right now. There's aspects of our industry that are collapsing, that will not return any way, shape, or form of what they were because of that transformation. We know that through digital health, pharmacists are a little bit more hands-on now with certain treatments, especially chronic conditions. We know that digital health and artificial intelligence are changing the game and is going to accelerate innovation. But guess what? There's something about the human side of us that seems like it's taking a real beating through what we're going through as a profession, and the burnout and the pharmacist suicide and the collapse of people's businesses that they've worked generation from generation to. I mean, there's a lot of hurt in pharmacy right now, and I couldn't think of a better guest on This Week in Pharmacy to bring on to talk about his mission and his purpose, literally, Ritesh Shah and Joe Howe. This is so special for you to share this with us in This Week in Pharmacy. Thanks for being here.
Thank you. Thanks so much for having us, Todd. My name is Joe Howe. I'm the president of the Ritesh Shah Charitable Pharmacy, and with us today is the founder, Ritesh Shah, America's pharmacist, the two-time pharmacist of the year. He goes by many titles, but the most recent one he added is author. When he started this book, I suggested to him that it should be called Chicken Soup for the Pharmacist's Soul, but he called it Pills to Purpose. And he's here today to tell us about his journey, Pills to Purpose. Of course, available on Amazon, Kindle, paperback, hardcover, or wherever you get your books. Ritesh, thanks so much for taking the time today to tell us about your book and your journey. Why don't you tell us, Ritesh, you're the Chief Executive Officer of Legacy Pharmacy Group. You have hundreds of pharmacies in your GPO. There, you're an entrepreneur. You have many successful businesses. What made you start a charitable pharmacy?
Thank you, Dr. Howe. Thank you, Todd, for this. I carry that pharmacist soul. Not only am I a pharmacist, but I'm married to a pharmacist. That's developed my experience. And I always say there's no drug interaction, only time that happens. But owning drugstores for more than 2 decades and serving Monmouth County and a greater New Jersey area. And when I had that honor of getting that phone call from my chairman to join as a CEO of Legacy Pharmacy Group, we walked right into pandemic. And the question I had asked myself was, what can we do to help? And supporting my community during those the hardest time that we have seen on earth. But when I lost my baby sister, mission became something bigger and better within her heart. How do we honor her? And that's how the New Jersey's first and only charitable pharmacy was born, to serve underserved by providing medication access to the people who don't have one. In my simplest way, as I have seen throughout my career, how people had struggled for the medication. And we just wanted to be there for them. And if they had to pick $10 for the food, we wanted them to save that $10 and use that money for the food. And they can come to our drugstore and they can get the medication at no cost. We have about 300 different medication, life-saving medication, self-funded, family and friends funded. And this mission, which I call Temple, where we have served more than now $2 million worth of medication at New Jersey's first and only charitable pharmacy. So this mission is very close to my heart. And the book that I was able to write, a true story of my personal life and incidents that happened in the last 25 years throughout practicing as a pharmacist, and this pharmacy was born. I was able to put it into paper and wrote 1,000 pages, and my daughter, who inspired me to put it into book. And now this book has published. It's the story of a pharmacist, how pharmacists can come from the pharmacy to the front lines, and how do you heal beyond the counter? How do you go out there? When we took the oath to serve as a pharmacist, this is a call of action, came at the Shah family, my wife and I, we started this mission, and so many like you, Dr. Howe, joined. And I was able to put some of them into my book called Pills to Purpose. Thank you.
Yeah, and thank you for reminding me. I can't say that Ritesh is the number one pharmacist in New Jersey because his wife's a pharmacist, so she's always number one. He always falls into second place there. You've been a long-time advocate for community pharmacists, for independent pharmacies. How did that role change during the pandemic? And you speak in your first couple chapters of your book about what the pandemic was like for you on the front lines and how that brought you from behind the counter. Could you talk to us for a couple minutes about that experience?
Well, first and foremost, I was scared as a pharmacist. Everything was shut down. I was actually in Punta Cana for my time off, and I heard all this thing, flew back right in, and very next day, we were shut down. And as a pharmacist, the question came, what can I do? How can I do? And how can I help? I remember my phone call with Senator Vengopal and my late night phone calls with the governor's office. And what I requested that COVID testing access should be given to the community pharmacy, independent pharmacy. And the mission started. We deployed 100 plus pharmacies, done 5 million plus COVID specimen collection. We went on record with Board of Pharmacy to asking for us to do this, and even op-ed went in what pharmacists can do. To be honest with you, people were calling, and every morning out of my garage, from my home garage, like 6 o'clock, so somebody wanted to fly in, and they wanted to get COVID testing done. It was just totally different thing. It was not about making money. It was all about saving precious human life. And while all these things were happening, the core of pharmacists woke up. Not only in me, but in so many pharmacists that they really went way beyond. They bent themselves backwards. I remember at Little Silver train station, at Hazlitt train station, working with so many legislators, and in cold nights, we were doing COVID testing and specimen collection, and then vaccination at the Freehold Borough Hall, my hometown in Freehold. It was just something that pharmacists had that unique opportunity, and I'm thankful to all my fellow brothers and sisters, those who are pharmacists and healthcare heroes in so many fields, all the nurses and doctors, what they have done. It was a teamwork, and I'm glad that I was able to do whatever small portion of it during pandemic as a pharmacist.
So I think you're underselling yourself a bit there. So my background is as a school administrator, an unlikely friend to pharmacist. And suddenly during COVID, Ritesh becomes my best friend. We're on the phone multiple times a day, starting at 4 a.m. And if it weren't for you, Ritesh, we wouldn't have been able to reopen school. If it weren't for your COVID testing, your vaccination effort when that came out, and Ritesh came himself to administer tests and give vaccinations to our community. And I think in speaking with the residents, when they learned that you were pharmacists, they started telling you their stories about, I have diabetes and I have trouble accessing my insulin, or, my child has asthma, I can't get them the inhaler, or I can't get them the nebulizer. And so what did that experience do for you in changing your mind to reshape pharmacy, really rethink how the pharmacy works?
Dr. Howe, amazing question. There was always hard, and before even this charitable pharmacy was born, we were out there in a community doing, diabetes education seminars in a senior centers, and asthma, and working as a preceptor with the students at Rutgers Pharmacy School and taking students out in the community. But how I said on CBS 2 News, we live in a broken system. There are about 1 or 2% of people out there don't have access. And there has always been a desire, how do we help those patients and those who don't have it? The birth of the charitable pharmacy was nothing but with all this thing that happened and been happening, when you had something that very dear and near to your heart, and when you lose that person, a brother, a sister, the sibling conversations that we had. Hey, you have access to this, so many pharmacies, and you do this. Why don't you do something those who don't have any access? So to honor my baby sister, I think this pharmacy was born, and this is how we went into Red Bank. So it is an open door pharmacy where patient with the 3 or 4 different kind of medications that we have, one with the diabetes, one with the heart conditions and blood pressure, mental illness, and nutritional. Those are the 4 diseases that my sister had suffered during pandemic, and we lost her. And we opened up these doors. Hope I answer your question.
Yeah, so the pharmacy's been open 3 years now. The physical storefront is in Red Bank, New Jersey, but it's gone statewide. Within the first year, we're serving every county in the state. As you said, over $2 million worth of medication dispensed, thousands of prescriptions. We have hundreds of patients that get refills on a daily basis. You talk in the book about sustaining the organization. Can you tell us what made you write this book? Why now? Why write this book now?
So writing the chapters and papers on a scrap paper, but why now? Because pharmacists, they play a very unique role in healthcare, whether they're community pharmacists, hospital pharmacists, or nuclear pharmacists, or any role. But as a community pharmacist, where you are involved in that community, I want my community, my state, my country to know that pharmacists can go way beyond the counter, and they can do what is necessary as a pharmacist. Dr. Howe, I remember going to India in October 2021 to meet my baby sister to celebrate Diwali. And if you remember, there was a peak of COVID surge that time. And unfortunately, she was on ventilator, and that meeting never happened. And coming back to the home, the purpose became very strong. How do you convert that pain that I went through and honor her by providing that access? So the idea came in. I thought I'll just go to Board of Pharmacy and apply easily. And New Jersey Board of Pharmacy didn't even had a classification about charitable pharmacy. And they've been very kind to our application. And we applied to open up New Jersey's first and only charitable pharmacy. But sustaining the organization, let me tell you, if Asha, my wife, who retired, And it reminds me of the story after she retired and the pain that I was going through. She told me, Ritesh, I'll be nice to you again after 25 years of marriage. I'll put my white coat on so we don't have to worry about having pharmacists at the charitable pharmacy. And God is, we are blessed. I have this beautiful building that we put it for this purpose. So there's no rent in this building. There's no pharmacy salary in the beginning. When Asha joined and put close to about 3,000 hours straight. So to make your organization sustainable, you need the space, you need the pharmacist, you need the medication. We've been blessed and we've been able to do all this thing. But you know what? The mission became so strong. So many highly talented, highly decorated people joined our mission, our amazing advisory board, accomplished people, and joined my mission. And I was able to put all the expertise and things that I had in my daytime job as a legacy pharmacy group, working with the pharma manufacturers, working with the pharma vendors. And they all joined my mission with so many doctors and the attorneys went through some hurdles, and I had to make sure that we go through this process. It was not easy, but one thing was for sure, and it was determined that we'll make this happen. God will involve in our mission, and I'll be able to do my job as a pharmacist. And the doors were open on a Good Friday. It reminds me the email from Reverend Porter from Pilgrim Baptist Church saying, the Hindu by religion Shah family comes to our highly dense Christian community on a Good Friday to open up the charitable pharmacy, and which was a Passover for Jewish faith in a holy month of Ramadan. Unquote. It was a beautiful thing that happened that day, and it's now, this April will be 4 years. And we have about close to 500 patients that they rely on us. Eli Lilly been very kind, and medication to access, right? The access and having those very very costly insulin that we have it at the pharmacy that we provide to the people who have no access. So when
you only accept uninsured patients at the pharmacies, right? You don't bill any type of insurance. You don't take any payments from the patients. Is that right?
That's correct, Dr. Howe. There is no cash register.
Yeah. So the main funding is from donations. Then is that right?
It's a family funded, family and friends funded. We are so thankful to Senator Vin Gopal. They were able to get us, second time grant from state of New Jersey from the budget, so we can serve more people. As you know, Medicaid cuts, and so many people now not only relying on this, but these are the stuff that is happening at the charitable pharmacy.
And now also all of the proceeds from the book, Pills to Purpose, now available on Amazon, also goes directly to patients' medications to save a life. The last question before we wrap up here, Ritesh. So you're a 2-time Pharmacist of the Year. Is it true that they made a rule now that you can't get it for a third time? That they're, otherwise you'd just be winning every year. It's not fair to the other pharmacists. Is that right?
I'll put it in my daughter's words that give somebody else an opportunity. But one thing I'll tell you, and I'm so thankful to Todd and the Pharmacy Podcast. Listen, I'm a pharmacist. I'm one of yours. I know you all have done it. You all are unsung hero, and so many. This is not my story. This is a story of pharmacists. When you hold this book in your hand, this book is a pharmacist written book. And all the chapters, when you see it, I guarantee you, pharmacy will be, hey, I have done that. I remember helping out that patient when they didn't have the money. I remember I gave that inhaler to that patient. I remember delivering this medication in that cold winter when we had a lot of snow. So the pharmacists, they go way beyond, way out of scope to help people. And this is a pharmacist story. I was just able to put on a pencil and paper a couple hundred pages to write. And every book that gets sold, all the contribution, all the money goes to the charitable pharmacy. And you are helping one book sold is one life saved. You are helping patient by not only saying what pharmacist does, but you are helping and you're doing God's work. So this is what the purpose is all about. I know I went through the pain. I can't change that, what happened in my life, but I know for sure what I can do is take this mission forward. And we are all children of one God, and those who don't have access want to make sure we provide that access. I just don't want to miss this opportunity to say thank you to all my fellow pharmacists, my program director, all my staff, my volunteers, and my board members, who they do way beyond scope. And a special thanks, Dr. Howe, for our current president, who is not only taking this mission forward. He's an ex-superintendent of Freehold Borough Schools and now VA at a Magnet Schools. He has an amazing daytime job, but what he does for pharmacy and community, I don't have words for it.
You guys are awesome. You're the future of our profession, to bringing that heart back to it, and let's start paying attention to the individual needs of people that are out there that can't even afford medications that are going to keep them alive and keep them living better. And this is a beautiful story that you've shared with us, Ritesh. I want to thank you. Joe, thank you so much for being a host today and just pulling this story out of somebody that I know that you love, and I know that you care about, Ritesh, and I know that his success is your success, and literally it's the whole profession's success. Is if he was successful in his mission of Pills to Purpose, then we would all be in a much better place. But it's just like one patient at a time, one day at a time, and I can't wait to see you at another pharmacy gathering. Ritesh, where are you going next? What event will you be at in the next several months?
Well, in the next several months, Prime RX has their show. I will be there, and we'll be doing and reaching out to the people to share this purpose. I want to make this urge and humble request for every pharmacist, the technicians, and customers and patients. Helping and buying this book is helping one patient. So I kindly urge that you purchase this book. It's available on 50 plus platforms: Amazon, Barnes and Noble, Apple Books. Those who are,
it was the number one pharmacy book on Amazon. We're going to try to keep that going, but over the weekend, it was the number one pharmacy book on Amazon.
Yep. Our website, pillstopurpose.com or rscprx.org. You can support this mission and join and help us to do God's work. Thank you.
That is awesome. Thank you both for being on today's This Week in Pharmacy, August 15th, 2025. I can't wait to have you guys back. Make sure that you come back and share with us on This Week in Pharmacy. Thank you.
I'll be honored.
Looking forward to it. Thanks.
See ya. Great interview with Ritesh. What an inspiration he is. Shout out to Sykes and Company for sponsoring this TWIRx and this episode. It's important that we have that kind of support. And Bonnie, you are up next. Can't wait to hear from you.
The aspect of accounting is probably the bane of my existence. And I just before I started recording with Bonnie, I said, my accountant must hate me. And my accountant is actually Sykes and Company. Sykes and Company. So I'm excited to have Bonnie here. Introduce yourself to our listeners and talk to us a little bit about.
Yes, I am Bonnie Bond. I work for Sykes and Company. I'm a CPA shareholder, MBA. Been working there for about 21 years, which is a long time to be with the Sykes crew.
Right.
Alan Sykes and Scotty.
You might.
21 years. But yeah, I work with pharmacies all over the country. I love it. It's my favorite thing to do. To build relationships with pharmacists all over the place. And we have employees all over the country, but we offer accounting, CFO services for independent pharmacies, again, all over the country. So we can handle your entire back office, consult with you, tax planning, tax prep, of course, And we also do consulting with transitions, whether it be startups and then those purchasing stores and selling transactions as well.
So, Bonnie, I'm glad you brought up startups because I get excited with the whole thought of startups because today's startup is going to be so different than what the startup was 10 years ago.
Yep.
Because they're going to be positioned in understanding that there's ways to make money as a startup from just a dispensing fee, but now it's going to be tied to services. By the way, we're in Outcomes booth. That's part of it, meaning the treatment plans that you have are going to make you money. The CPT codes and the ICD-9 codes mean that there's billable services. So let's talk about startups. So there's a pharmacy owner, there's a pharmacist out there that's working for a chain. There's a pharmacist out there who's working for an independent. Maybe they're doing a partnership, but regardless, they want to start their own pharmacy.
Right.
So let's talk about how Psych supports that process.
Yes. So I just want to say we just came off of one of the NCPA ownership workshops, which we speak at every trimester. They do 3 a year. And it's full of people that want to jump into ownership for independent pharmacies, whether it be a startup or purchasing a store. And I'm always blown away by the amount of people in those sessions that still, even in today's environment, because people feel very nervous in the independent pharmacy industry sometimes, that still want to do startups. And so it's usually half the room.
Mm-hmm.
So that's normally where we start and meet a lot of our startup clients. We offer services to help you during that process, work with you from start to finish. When I mean finish, opening the door.
Yep.
And we're kind of just the quarterback in that process, working with your bank, with lending, making sure you have enough working capital to get everything going, looking over your lease that you're looking to sign. Again, making sure that you have the right money in place, that you can work with your regulatory groups to make sure you get all your contracts in place before you open. And just, we set up the accounting file. We help you set up your entity, any kind of tax elections that is needed. We do all of that. In anything, we're just kind of your quarterback through that process from start to the day you open. Make sure you're ready to go.
So if I'm starting a pharmacy, give me some like bare bones stuff that if I've had this dream, I want to open a store, I want to start up, or I want to even start up a secondary location.
Right.
Talk to me about the bare bones. What do I need to bring to you?
Because I want to mention that really, really quick. What we're having a lot of right now is current ownership. And with a lot of the big box stores that are closing, there's lots of opportunity for some of these startups to jump in and pick up some of these patients.
Pharmacy deserts. Exactly.
Yes, absolutely. And so, but yeah, right from our main goal is to make sure that you are set up correctly as far as your entity selection. And that can vary depending on state. People a lot of times will start their own entity because that's not hard to do, to set up an LLC.
Mm-hmm.
But then they spend, maybe that's been a year or two. They don't realize they've had tax filings. They don't realize all these things that should have been done from the beginning. It's really great to start with a good foundation. It could be cheaper in the long run to just pay someone to help you do it right from the beginning instead of having to go back and fix it later. And then the other thing that's really big is the financing or the capital injection that people bring to the table. We meet with people a lot that have they're close to opening and they come to us for help and they say, we're like, how much money do you have in the deal? Or how much is your bank giving you? And if it's not a pharmacy niche bank, a lot of times it's a local bank and they say, oh, well, we have $150,000 to get going. You cannot open a pharmacy with $150,000. So we normally see minimum $500,000 to $600,000 to sometimes to $800,000 that you need to get everything going, because people forget that the inherent nature of pharmacy is the receivable situation. So, and the growth with a startup. So you could open your doors and then grow like crazy, which is a positive thing, but you will run out of cash very quickly because of how you're having to pay your wholesalers and you are not receiving payment for sometimes 21 days to a month.
It's crazy.
So, and growth just compounds that and you will run out of cash. We want to make sure people are using the right banks for financing. We're big on, and that same thing for attorneys. to use a pharmacy niche bank, to use a pharmacy niche attorney, people that understand that to make sure all your contracts are done correctly, and on the regulatory side as well. A local bank, it may be a great relationship that you have with someone in your hometown, and
But they don't understand pharmacy.
They don't understand pharmacy, and they're not going to. Usually, they do not give you enough working capital to get the deal going. And then when 6 months comes, 6 months down the road, you run out of cash because you're growing like crazy. They're not going to give you money, any additional money, because they don't understand why. They're like, well, where's the money? What happened? Where a pharmacy niche bank is going to, number one, they're going to make sure that you are fully capitalized to begin with. But then if they understand the growth, they understand what's going on, they won't be more likely to help you.
Love it.
Yeah, get more if you need it. So.
Well, I like the direction. If you're listening right now to this podcast and you're like, hey, I've thought of starting up, I want to talk to someone that really understands the business, reach out to the Sykes company, reach out to the Sykes team. Bonnie, what is the best way for a listener to reach out and get in connection with you guys?
Check us out. Can I plug my podcast on your
podcast?
podcast?
Absolutely. Well, your podcast is part of our network.
Exactly. So the Sykes Bottom Line Pharmacy podcast, we just throwing that out there. We have just free information.
So much free information.
Great vendors.
I'm going to actually say Olin, who's the OG.
Yeah.
Right. He's had a YouTube channel
forever.
For 10 years plus. So there's so much content out there. If you don't know about the Sykes content library, I want you to search them on, and you can put in any of the social media. Austin's doing an amazing job in blowing you guys up. But look for Sykes on YouTube, and you could go Sykes Pharmacy. If you Google Sykes Pharmacy Accounting, it comes right up.
Yeah, our YouTube channel is full of decades of videos that is current today. But free information. If you can't sleep at night, turn that bad boy on and just listen. But also you can check out our website and schedule a call with any of us. I work a lot with startups and transitions. You can see my calendar live and pick a time that works great for you, and we will be glad to talk with you about it.
And master the margin.
Yep. And we got, hopefully, I think July 31st, we are having a webinar about the new tax bill and all the updates, and not just a generic one like everyone's doing. It's going to be all the details on how it affects independent pharmacy
very specifically.
So we're excited about that. You can register for that as well on our website.
Very good. All right. You heard it here at ThoughtSpot 2025. We are excited to be here, and thank you so much, Bonnie, for this time.
Okay. I appreciate it. Thanks, Todd.
Feeling lost with the complexities of pharmacy accounting?
In pharmacy today, there's so many different, variables and issues that impact the pharmacy books, records, accounting, the profitability of the store, so forth. There's different components of pharmacy that have its own nuances from an accounting standpoint. And so it's tricky. There's no doubt about it.
Ready to take your pharmacy to the next level but don't know where to start? Sykes & Company is here to help. Introducing the RX Assessment. With the RX Assessment, the pharmacy CPAs and advisors at Sykes will do a deep dive into your accounting and tax situation and give you the action steps you need to take your pharmacy to the next level.
If you're interested in, working with a team who understands the industry and how the accounting and tax should really be in a pharmacy, this is your chance to get a under the hood check of what's going on and getting the feedback of any issues or concerns or, again, things we think you're doing really well with.
Get the financial checkup your pharmacy needs and head over to sykes-cpa.com or call 252-482-7644.
Hey, and on This Week in Pharmacy, I want to welcome back a friend of mine I met years. I can actually say it's been years now, Sherlick. I can't believe that it's time just goes like that. I blink and it's gone. But I want to introduce yourself to our listeners and what you do at TaylorMed.
Yeah, happy to be back. This time remotely. Last time we recorded, by the way, Todd, it was 3 years ago. I think it was my first Assembia. So we'll talk about that in a second, but I'm Sulik Dvorsky, the co-founder and CEO of TaylorMed, the largest medication affordability network in the country, and a healthcare IT company that basically connects patients with resources to reduce think I lost you.
Oh, no, I'm still here.
I think what we were broken out when you started sharing.
Plugs into specialty pharmacy.
Yeah, of course. So TailorMade is a technology platform that basically is able to identify any patient throughout their care continuum in any medication encounter. And when there is a financial need for a patient, we're able to automate all of the steps related to eligibility to assistance programs, enrollment, collection of copay claims, ordering of free drugs, and the entire life cycle. We do that for providers from small community practices to the largest health systems in the country. We do that for pharmacies, retail, infusion, and specialty. And in all of those cases, the idea is pretty simple. We have a data integration to the IT system. It could be a pharmacy IT system or an EHR or both in some cases. We have a database of all available programs, and we help identify the patient early in their journey when they're just prescribed and in every medication encounter they have. And obviously, if we're successful, not only does the patient benefit by seeing a reduction of their out-of-pocket cost, our customers, who could be, by the way, specialty pharmacies, benefit because they can provide better care, but they are made financially whole. And we're drastically reducing prescription abandonment rates.
So there was some news about you and a partnership with Regeneron. That's a really good example for our listeners to understand how this ties in. So go through that partnership and the benefits to our patients.
Yeah, I think maybe taking 30 seconds to go back 3 years ago, we never had even one manufacturer that we work with. And I think it's because in this space, in general, when you are trying to create a network, there is a big chicken and egg problem. Yep. Do you have enough patients, enough prescriptions, enough facilities in your network to justify going to a Regeneron and say, hey, can we do something to make the enrollment to your programs even easier? And I think for us, it was about a year and a half, maybe 2 years ago, when TailorMade got to a scale that, first of all, was the biggest in the industry. And two, it not only allowed us to come to pharma, we started actually having manufacturers come to us and say, we see that you are deployed across so many different sites of care. Is there a way for us to partner technologically together to remove a big barrier, which is how do patients become aware? How do users or care navigators become aware of programs? And how can we streamline the enrollment to a single-click enrollment, which is, by the way, what we do with Regeneron. So we just launched one of those programs. It's one of more than 100 programs that we already have. In that case, it was with Libtayo, a cancer drug. And the idea is when a patient is on that drug or is prescribed that medication, how can we streamline the time and the process from when they are prescribed to when they can get to the first therapy and completely alleviate the financial concern that they have. And Regeneron, fortunately, is one of 8 large manufacturers we already work with. And we're seeing a speedy growth of more and more programs related to financial barriers, but not only.
That's exciting to hear. It's very proactive. And that's one of my questions, because every time I start hearing about programs that are added to assisting the patient, I start thinking of workflow. I start thinking of the pharmacy management systems, the Assembia ones or the Theragies or the Pioneer RX or whatever it is. So talk to us about, if I'm listening as a pharmacist, how does this parallel in the workflow for when I'm getting my patient registered, I'm getting them up and running, and then as a specialty pharmacist, I'm starting to meet with them on a reoccurring basis. When does the TailorMade system come in?
I think that you are bringing up a critical point when it comes to technologies in general and definitely ours. What we've learned over the years is that we can build the best product out there, but there are 2 critical success factors that we have to work with our customers to make sure that the value is actually being realized. One is that integration. We need to make sure that we are reducing manual data entry and completely eliminating dual recording of data. And for that, we need to be integrated to their pharmacy IT system, if they're a pharmacy, or to the EHR, if they're a provider organization. And that allows them to be in their own workflow. So if I'm a specialty pharmacy, a prescription has been received, there is an intake process, I want TailorMade to be prompted within their workflow to say, the patient has financial need, but we found a financial assistance program. They click there, they are navigated to the specific case in TaylorMed, they enroll and come back without needing to manage too many different workflows and different systems. And as you know, it doesn't have to happen only when the first fill is happening. It might be in the next fill. It might be when they change insurance. It might be when they change a treatment course. And we want to make sure that we are at the fingertips of the patient coordinator or the patient support services person in every step of the way. So that's one thing. Even if you have that, you still need to partner as not only a tech partner, but a real true partner to help the specialty pharmacy have change management, to actually have the thousands or hundreds or individual users be able to change their workflow. And that is the hardest thing. One of the things that we're going to do at NAS, by the way, which is the next conference I'm going to, is sit down together on a panel with some of our partners from CenterWell, from Prime Therapeutics, from Allevia Health, to talk about how are we transitioning a manual process to an automated one. But what does it take not only from the technology side, but as partners together to change the behaviors across their pharmacies?
Share with our listeners again, you're going to the National Association of Specialty Pharmacies annual event. You're going to be on a panel. What's the name of the panel and what will you guys be discussing?
So it's actually an educational panel there, leveraging technology to scale affordability programs in specialty pharmacy. And we're going to talk about exactly that. How can specialty pharmacies, programs across those pharmacies can adopt and scale to address what has become a real crisis of affordability in America? And it's definitely something we see more of in specialty care.
We're excited to continue to learn more about TaylorMed. We were excited to interview you when we first did the interview at Assembia, and then your connection to the NASP as well. It's going to be at the Gaylord Rockies Resort and Convention Center in Denver, Colorado. That's going to be September 14th through 17th. Shrelik's going to be there as a panel discussion, and this is important stuff. I want to invite you to participate in a follow-up interview when we go to the NASP and bring an associate, bring a pharmacy that you work with. But let's dig into this more because we have to have our providers, our pharmacists listening, our operators and administrators understand the opportunities that are out there that can really help their patients dial into better care and fluent care that's actually being paid for.
Absolutely. I think any of the panelists with me, whether it's CenterWell, Allevia, or Prime Therapeutics, will be happy to join because one of the fun things about what we do, people are so passionate about this space because they know that if they do it right, they don't only help their pharmacies, they actually help patients.
I love it. Shrelik, how do people get a hold of you? What's the best place to go to access more information about TaylorMed?
Yeah, first of all, feel free to reach out on our website, taylormed.co. But if there is anything that I can do and happy to talk about the space with anyone, my email is srulik@taylormed.co, and feel free to reach out.
Absolutely. Once again, that's TaylorMed. That's TAILOR, taylormed.co. Shrelik, this has been great. We really appreciate the update on This Week in Pharmacy.
Happy to be here. Until next time.